We are joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Doctor, welcome back to the show.
Thanks so much for having me today.
So, how has the holiday season affected the fight against the coronavirus in Canada?
So predictably so, we've seen a massive increase over the holidays there. While everyone did promise to stay safe, everyone's Instagram says something a little bit different. On December 22nd, we saw about 6,000 cases across Canada. And in the coming days, we saw 7,000, 8,000, 9,000, and peaking at 10,000 cases in January 2nd. Luckily, after the spike, I suspect we'll see a nice decline in cases as well.
Now, we have 2 vaccines currently being circulated across the country. However, only about 0.3% of the national population has actually received the shot, while hundreds of thousands of doses are still stored in freezers. So, Dr. Raut, should this vaccination program be scaled up?
Absolutely. If you look at the first vaccine, it was actually administered in Canada December 14th. And since then, only about 121,000 people have received the shots. So most of the provinces have about 70% of their stock in freezers. And PEI is probably the only province that has even come close to the 1% of their population. So based on that alone, I think we really do need a full-scale, massive rollout in order to meet our deadlines.
So how can Canada speed up its vaccination program?
So they've done a few things that are very important. Step 1 is always to target groups and put group populations into phases 1, 2, and 3. The second step is to really target hospitals and long-term care homes with targeted preventative programs. So going into the long-term care homes, going into the hospitals. Step 3 is to utilize all of our community resources to expand our program. So that means our family medicine clinics, our walk-in clinics, our pharmacies, and even our schools. Remember, we still do vaccinations in schools for multiple diseases, so we should certainly be utilizing that as well.
And what do we know so far about the differences between the Pfizer-BioNTech vaccine and the Moderna vaccine?
The Pfizer vaccine, it has to be kept at -70 during transport and storage, so it's a bit harder to keep it at that level, and it can only stay in the refrigerator for 5 days. The Moderna can stay at -20 in storage and about 30 days in conventional refrigerator. We don't expect any of these vaccines will be in a conventional refrigerator for very long because they'll just be giving out the vaccines there. But overall, both very exciting prospects for vaccination.
And are there any benefits to receiving one over the other?
Not really. Both vaccinations have an efficacy rate above 90%, so we don't consider that to be an issue. The most important thing here is to get vaccinated as soon as possible. And the worst thing someone could do is to wait and just try to figure out which one is slightly better.
All right, Dr. Raut, I really want to get into this new variant of COVID-19 that's popping up in Canada. What does the medical community know so far about this variant?
What we know is it's called the B117 variant. There are about 22 to 23 different coding changes in the virus genome. And these changes unfortunately mean that the virus can spread much faster. In fact, the concern that it can spread 70% more transmissibility than the current strains.
Now, there's another new strain in South Africa. So I'm wondering, why is the virus acting this way and mutating into new variants?
Yeah, well, we do expect mutations, especially with coronaviruses in general, influenza viruses. We see that we have to get new flu shots every year for that. So it's not surprising to see this type of mutation after almost 6 to 9 months here.
And how effective are the current coronavirus vaccines against this new variant in Canada and the UK?
So we've been extremely lucky. So far, all of the identified variants have not mutated enough to be ineffective against the current vaccines and the prospective vaccines. So what does that mean? Our strategy stays the same. Keep on vaccinating and vaccinate as much as possible.
All right, Doctor, we've got about 30 seconds left, but would speeding up vaccinations across the country also have an impact on the speed that this virus mutates?
It's a very valuable question, actually, and the answer is a resounding yes. Every time a person gets COVID-19, their body becomes essentially almost a mutation lab for possible new strains. So the more we vaccinate, the less people will catch COVID-19, the less viral load in the community, and the less chances of mutation.
All right, Dr. Raut, thank you again for your time today.